Greetings of the day, folks. In this video, we are going to discuss about the differential diagnosis for wheezing in infants and children. The first most common thing that we come across when we come across the wheezing patient is the first differential will be obviously asthma. Typical age of onset is more than 1 to 2 years. The cardinal symptoms would be recurrent episodes of wheeze or nighttime cough, identifiable triggers such as seasonality, allergens, exercise, and after we provide bronchodilators, then there will be a good response. So the confirmatory test includes the by using trial of beta agonists and also pulmonary function test and allergy testing. The second differential diagnosis is bronchiolitis. It is less than 2 years. Mind it, here it is more than 1 to 2 years, this is less than 1 to 2 years. So the most predominant symptoms we find when a patient presents with bronchiolitis is upper respiratory tract infection symptoms and seasonal, and it will be seasonal, like more in the winter months, and there will be nasal flaring and congestion and wheezes, rales and bronchi. And we should consider viral antigen testing for confirmation. The third differential diagnosis would be the gastroesophageal reflux, and normally it will be present from the birth, and also tracheoesophageal fistula. These are the congenital malformations, right? So it will be present from the birth, and patient might have cough, gagging, emesis related to feeding. And the confirmation of the GERD, gastroesophageal reflux, would be esophageal pH probe, and for the tracheoesophageal fistula, we need to get barium swallow. The other differentials are vascular ring Sling malformation or airway hemangioma polyp. Normally, it is usually seen in early infancy, and these may be tracheomalacia or laryngomalacia. They usually present from birth and improves during the first year of life. And the patient mostly will have stridor that changes with the position of neck, and there might be some exacerbations associated with the upper respiratory infection. So the confirmation would be with the chest X-ray, CT angiography, and bronchoscopy, barium swallow, and laryngoscopy. The other differential would be the congenital heart disease with the left to right shunting and congenital failure, congestive heart failure, and myocarditis. It is usually seen in 2 to 6 months of age, and after that also we can see it in any age as such. And the finding would be diffuse or basilar rales, tachycardia, hepatomegaly, cardiac murmur, gallop, etc. And the confirmatory test include chest X-ray, ECG, echo. Then for the myocarditis, similar to the congenital heart disease, chest X-ray, ECG, then troponin and echocardiography. The other differential would be foreign body aspiration and vocal cord dysfunction. The foreign body aspiration is usually seen in more than 6 months, where the weaning is started, and after that the history of foreign body aspiration and the symptoms might match. Before that, only exclusive breast milk is advised. And history of choking episode with subsequent onset of acute stridor and wheezing might be seen, and we can see it in the X-rays, that is both inspiratory and expiratory chest X-rays is required in this case for evaluating the patients. And vocal cord dysfunction, it normally usually when there is a paralysis, it is usually present from the birth, and it sometimes may be seen in late school age or adolescence. And patients will have stridor, wheezing, poor response to beta agonists, and flexible fiber optic laryngoscopy may be required for the confirmation of the vocal cord dysfunction. And in case of epiglottitis, normally it is usually seen in the patients who tend to be in a social environment, that is when they start on schooling or in adolescence. And presenting complaint would be stridor and high fever and toxic appearance, and because of epiglottitis there will be irritation to the mucosal membranes, and there will be drooling and tripod positioning for it, shortness of breath. And the findings can be confirmed by the soft tissue radiographs of the neck. The other differential would be any lower respiratory tract infection. It can be seen in any age and normal LRTS symptoms like fever, cough, tachypnea, rails, or nothing may be seen, and chest X-ray will be beneficial for the confirmation. Then the other differential will be the cystic fibrosis, celiac dyskinesia, and immunodeficiency. These are usually present from the birth, and recurrent lower respiratory tract infections may be seen, and failure to thrive may be seen. And for the cystic fibrosis, sweat chloride concentration may be required for the diagnosis, and for the ciliary dyskinesia, ciliary biopsy may be required, and for the immunodeficiency, immunoglobulin assays may be required for the confirmation. Thank you very much. See you soon.